Pause. In the next minute, you'll feel your shoulders drop and your breath deepen. Welcome to a gentle, open-formed session of breathing and relaxation exercises for pregnant women featuring guided visualization with deep breathing to ease anxiety, sleep better, and prepare your mind and body for birth. Here's what you'll experience. We'll ground with a body scan and rib-expanding 3-part breath. Then I'll teach pregnancy-safe calming breaths like the long exhale without long holds. Next, we'll step into your private shoreline, a visualization to practice riding contractions. We'll close with a daily routine and a 60-second reset you can use anywhere. As always, listen to your body and check with your provider if you have concerns. Find a comfortable upright or side-lying position with pillows. If you're ready to trade worry for spaciousness, stay with me. Inhale through your nose for 4. And exhale, slower, for 6. Your calm starts now. But before the video starts, write in the comments, from where you are watching this video, thank you. Before you scroll, try this with me. Place one hand on your belly, one hand over your heart, soften your jaw. Inhale through your nose for a slow count of 4 and exhale like a warm, unhurried sigh for 6. Feel how your shoulders drop without being told, how the space around you seems to widen by a quiet inch, how the chatter in your mind gently steps back, and imagine, just for a moment, that the air is a friend arriving exactly on time. Because in the next few minutes, I'm going to invite you into a calm, evidence-informed approach to breathing that becomes a shelter you can carry anywhere, created specifically for pregnancy. So it never asks your body to do acrobatics, never requires long holds, and never asks you to push past your own edges, only to meet your inhale with honesty and your exhale with generosity. So that on days when sleep feels far away and worries grow loud and your body feels like a beautiful new country, you still know how to find steady ground and let the tide move with you, not against you. This video is your soft place to land. And it's crafted to meet you exactly where you are today, whether you're in your first trimester, learning the new rhythm of your body, in your second trimester, savoring a bit more energy, yet craving steadiness, or in your third trimester, preparing your mind and nervous system for birth with practical tools that fit into real life. Together we will slow down time by paying close attention, and you will learn not only what to do, but how and why it works. So you can carry it beyond this screen, into the kitchen, onto the bus, into a midnight nursery, or anywhere your day asks for calm. Expect language that is gentle, guidance that is clear, and modifications that keep you safe. Because your breath is not a performance set, it's a conversation. And once you learn to listen for its cues, you'll discover how profoundly it can settle your body, organize your thoughts, soften anxiety, and teach you to ride waves with steadiness. Breathing and relaxation exercises for pregnant women. That is the heart of our session. Built on slow, diaphragm-led inhales and longer, easing exhales that nudge your nervous system from fight or flight toward rest and digest, paired with subtle movements and positions that respect pregnancy, like supported side-lying, elevated recline, or an upright seat with plenty of pillows. You won't be asked to hold your breath, strain, or chase big numbers. Because the most effective practice during pregnancy is sustainable, rhythmic, and kind. And the goal here isn't to become a perfect breather, but to become your own steady companion, the kind who can soften a tense morning, untangle a restless afternoon, and greet the evening with enough spaciousness to sleep. Let me show you the arcs we'll travel together, so you can picture how this time will unfold in your body. First, we'll settle with a short body scan to find ease in your face, neck, shoulders, ribs, belly, and hips, learning how to place yourself in a position that supports a 360-degree breath. Think of your rib cage blooming softly in every direction. Then we'll build a gentle foundation with 3-part breathing that expands low, wide, and back into your rib basket, not your upper chest. Because we want the breath to cradle the baby and the pelvic floor rather than crowd them. From there, we'll practice a calming pattern that lengthens the exhale without holding, something like a 4 in, 6 out, or a 3 in, 5 out. Always adaptable to your comfort, since research suggests a longer exhale can increase vagal tone and lower perceived stress. We'll add a touch of humming breath to subtly massage the vagus nerve and soothe the mind, and we'll fold in a tiny movement or two that free the ribs and shoulders so breath can travel more easily. Because sometimes the jam is mechanical, not mental. Guided visualization with deep breathing. This is where we step into your private shoreline, a quiet inner landscape you can visit anytime, where waves arrive at a pace that your nervous system understands. Together, we'll imagine a path through tall grass or pines, or a still lake. wherever your calm lives, and we practice syncing each inhale with arrival and each exhale with release. So that in moments of intensity, whether it's a difficult day or a labor surge, your brain already knows the map and your breath knows the timing. Instead of fighting the wave, you'll float it, noticing how a steady exhale becomes a raft, and how returning to the same mental image, over and over, can reduce anxiety because familiarity is a form of safety, and safety is what lets your body soften where it needs to soften and stay strong where it needs to be strong. What makes this approach different is not only that it's gentle and pregnancy-aware, but that it's designed to be useful outside perfect conditions, because most of life doesn't happen on a yoga mat in a silent room. I'll give you quick resets you can use in line at the pharmacy, on the couch at 2 a.m., or during a lunch break. Simple anchors like soften the jaw, drop the shoulders, lengthen the exhale, and feel the back ribs widen, that you can memorize in a week and lean on for months. And we practice a 60-second emergency calm you can pull out when your thoughts start running ahead of your day. You'll learn the difference between upper chest stress breathing and deep low parasympathetic breathing, and discover micro cues that rescue a breath gone tight, like lightly touching your lips together and exhaling through a tiny straw shape, or resting your tongue on the roof of your mouth to invite nasal breathing, or using a hand on the back ribs to remind your breath to travel behind you, where space often hides and tension settles. Let's talk safety for a moment, because your body's wisdom matters more than any script. This session avoids long breath holds and strong breath manipulations. You'll never be asked to push through dizziness, lightheadedness, or nausea, and if those show up, you'll be invited to pause, change positions, sip water, or simply return to your easiest natural breath. After the first trimester, I'll suggest supportive positions other than flat on your back. And if side lying is your best friend today, we'll use it. If you're managing conditions like high blood pressure, anemia, or pelvic pain, you'll be encouraged to work within comfortable ranges and consult your provider about what's right for you. Nothing here replaces medical care, and everything here is about adding a simple, kind skill to your daily toolkit, one you can practice without breaking a sweat, and without setting aside a big block of time. Because consistency beats intensity every time. If you enjoy a bit of science with your calm, here's the useful why behind what we'll do. When you shift from fast, shallow chest breathing to slower, deeper diaphragmatic breathing with a longer exhale, you stimulate the vagus nerve, which can help your heart rate settle and your nervous system tilt toward rest and digest. Gentle humming adds a vibration that some people find soothing. And visualizing a steady, predictable place can reduce cognitive load and signal safety, which during pregnancy can translate to more ease, better sleep, and a lower perception of stress. Add to that the subtle biomechanical benefit of breathing that widens the back and side ribs, creating a 360-degree hug inside your torso, which gives your pelvic floor permission to coordinate with your diaphragm rather than brace against it. And you've built a practice that supports you not only emotionally but physically, preparing you to meet labor like a series of waves you've already learned to surf in calmer waters. I want you to know that this space is not about doing it right, it's about getting curious, because curiosity is the opposite of judgment and the friend of learning. You may hear me offer images like let your ribs bloom or imagine your breath as a tide. Not as poetry for its own sake, but because your brain often responds better to story than command. And if picturing a shoreline helps your exhale become longer and kinder, that is useful. You might hear an echo of your grandmother's porch or a line of steam between kettle and window, the simple places where calm lives in ordinary life, because a practice that can be used in a messy kitchen or a noisy city isn't really a practice at all, it's a performance. Together we'll weave story and skill so that your breath is not something you do only in quiet rooms but a companion that meets you at the sink, in the doctor's office, at a red light, and at the edge of a long night, ready to be helpful without asking for perfect conditions. Here's how to prepare before we press play, where whatever lets your ribs move freely and your belly feel unpressured. Keep pillows nearby to support your back, knees, or head. Have water within reach and silence any devices that steal your attention. Pick a position that feels kind, upright with support behind you, side lying with a pillow between your knees, or a slightly elevated recline that keeps your chest open. And know that you can change positions at any time, because comfort is the doorway to effective breathing. If at any point you feel short of breath, dizzy, or emotionally stirred in a way that doesn't feel good, you are in charge. Open your eyes, look around the room, name 5 things you see to ground yourself, return to an easy uncounted breath, or pause the video. Your safety and agency are not optional extras. They are part of the practice. This channel is a community and your voice matters. Tell me in the comments which trimester you're in and what time of day your breath needs the most kindness, so I can tailor future sessions to your life. If you find value here, consider subscribing so you don't miss new practices, because the more we practice together, the easier it becomes to remember calm when you need it. And if you know a pregnant friend or partner who could use a pocket of peace, share this video with them because calm is contagious in the best way. Staying through to the end helps the algorithm. Share this with more moms. 2B, who are craving steadiness, and it also means you'll leave with a complete toolkit you can use immediately. No gatekeeping, no perfectionism, just simple, doable steps, repeated with warmth until they become second nature. Now, before we begin, let us preview the journey you're about to take so your brain can relax into it. We'll start with a gentle arrival, finding your supported position and scanning the body from forehead to toes. We'll learn the three-part breath that invites your low belly, side ribs, and back ribs to participate. And then we'll layer in the long, easy exhale, like drawing a soft line of calm across your day. We'll add humming and a tiny jaw release to invite your nervous system to soften even more, and then we'll step into your personalized visualization, the shore, the lake, the field, the place your inner breath knows by heart, timing breath with the rhythm of waves so your mind learns what to do when intensity rises. We'll close with a compact daily routine you can repeat in 5 minutes and a 1-minute reset you can use anytime, anywhere, so you walk away not just relaxed now but equipped for later. If you're ready, let us begin with a micro practice together to mark the transition from scrolling to arriving. Soften your gaze or close your eyes, let your hands rest where they feel natural. Belly, heart, back, ribs. Inhale gently through your nose, feeling the breath drop low and wide like a quiet bloom, and exhale longer than your inhale, as if you're fogging a cool window with kindness. Notice one thing you can hear outside the room and one thing you can feel inside your body, and let both be true at once. If you like, add a soft hum at the end of your exhale and feel how it resonates like a small, friendly engine in your chest. That's the feeling we're after, not perfection, not performance, but presence, because breath is both a tool and a truth. And once you make friends with it in the easy moments, it shows up for you in the hard ones. You don't need special gear, a quiet house, or an hour of free time to change the way you feel. You only need the next inhale, and the choice to lengthen the exhale by a beat. And this session will teach you exactly how to do that reliably, kindly, and safely, in ways that respect your changing body and your real life. You'll leave not just with a calm nervous system but with a map you can follow when the road gets bumpy, because practice builds memory, and memory builds confidence, and confidence builds ease. If you've ever wished for a button you could press to soften your day, consider this practice your finger on that button. If you've ever wanted a way to prepare for birth that respects both your physiology and your feelings, you're in the right place. And if you're simply tired and ready to feel a little more like yourself, you're welcome here. All right, get comfortable, let the room be ordinary, let yourself be ordinary, and trust that ordinary is enough. The breath will do the extraordinary part. Breathing and relaxation exercises for pregnant women. Guided visualization with deep breathing. Your calm starts now.